Atomy Eye Health Luaxanthin. Premium eye care that even treats tired eyes. Perfect care of both yellow spot and relieve eye strain. Health functional product. Atomy Eye Health Luaxanthin's specialty. Not only does it help maintain macular health, also relieves eye fatigue and helps improve overall eye health. 1. Eye health product with 4 functions: Lutein, Zeaxanthin plus Astaxanthin plus Zinc plus vitamin A. 2. 6 supplemental ingredients, verified once more. 3. Uses plant-based soft capsule, suitable for vegetarians. 4. Small size of 300 mg, easily take care of your family's eye health with 1 capsule per day. Product details. Product name: Atomy Eye Health Luaxanthin. Product type: health functional food. Net contents: 300 mg x 90 capsules, total of 27 gram. Ingredient list: Lutein, Zeaxanthin complex, Haematococcus pluvialis, vitamin A in oil, zinc oxide, grapeseed oil, gamma-linolenic acid, beeswax, soybean lecithin, citrus maxima, fruit extract powder H, red-orange extract powder, sickle pod tea extract powder, hyaluronic acid capsule compounds, food starch modified, glycerine, purified water, annatto extract, Monascus color, calcium phosphate mixed powder. Intake method: take 1 capsule once a day with water. Storage: store in a cool, dry place. Keep out of reach of children. Precautions: in the case of any special conditions or allergies, there may be excessive effects depending on the individual, so please check the ingredients before taking them. Do not consume the silica gel packet in the container. Those who are infants, children, pregnant or breastfeeding should be cautious when taking. In case of overconsumption, your skin may turn yellow. This may hinder the absorption of beta-carotene. In case of any abnormal side effects, stop taking and consult with an expert. Do not consume if expired. This is the supplement facts of Atomy Eye Health Luaxanthin. Product information: 3-ingredient complex of lutein, zeaxanthin, and astaxanthin to take care of your macular health and relieve eye strain. Lutein, zeaxanthin, and astaxanthin is known to help support vision and relieve eye strain. Lutein, mainly distributed in the periphery of the macula. Zeaxanthin, mainly distributed at the center of the macula. Astaxanthin or Haematococcus pluvialis can help relieve eye strain. Complex of 4 functions or quadruple function complex. 1. Lutein zeaxanthin complex can help with eye health by maintaining macular pigmentation density, which declines with age. 2. Haematococcus pluvialis or astaxanthin can help relieve eye strain. 3. Zinc, needed for proper immune function, needed for proper cell division. 4. Vitamin A, needed for eyes to adjust to dark places, needed to form the mucous membrane of the skin and maintain its function, needed for epithelial cell growth and development. First, lutein zeaxanthin complex extract. Lutein zeaxanthin complex extract is maintaining macular pigment density, which decreases with age, is important to eye health. Macular pigment is made up of mostly lutein and zeaxanthin. Macular pigment is not naturally synthesized within the body. It must be acquired through diet or supplementation. Lutein and zeaxanthin work great together in supporting eye health. Intake of lutein and zeaxanthin may help maintain macular pigment density. Lutein, in this product comes from marigold flower extract, is macular pigment component found in the periphery of the macula. Zeaxanthin, macular pigment component found in the center of the macula. Macula is the colored areas in the form of eggs around the retina of the human eye and some animal eyes. Macula has an important role in vision, such as recognition of objects and color distinction, where light entering the cornea and lens of the eye is matched and the river of objects is matched. The cone cells involved in light, color, and shape detection are located at particularly high densities. The cause of macular degeneration, capillary failure caused by abnormal vascular production in the retina, factors such as smoking, high fat, high calorie eating habits, stress, obesity, high blood pressure, and family history affect. Clinical test results. In these clinical trials, compared to other nutrients, intake of the lutein zeaxanthin complex extract was more effective in improving macular pigment density. The higher the intake of lutein zeaxanthin complex extract, the higher the macular pigment density. Second, Haematococcus extract, Astaxanthin. Haematococcus extract or astaxanthin may help relieve eye fatigue. Astaxanthin is a substance that animals use to protect their own bodies and is most commonly produced in microalgae, that is Haematococcus pluvialis. Haematococcus extract or astaxanthin may help relieve eye strain. Astaxanthin is a powerful antioxidant that promotes blood circulation in eyes to reduce ciliary muscle fatigue and improves eye control or eye focus. Eye strain. When you work by looking at computer monitors or smart devices for a long time, the shape adjustment function of your ciliary muscles are reduced due to strain. This function may not be restored even after rest. When looking farther, ciliary muscle relaxes, lens becomes thinner. When looking closer, ciliary muscle contracts, lens becomes thicker. When the ciliary muscle, which controls the lens thickness, is used by looking at a computer monitor or smart device for a long time, it becomes tired due to prolonged tension and thus its control function decreases. The control function of the ciliary muscle does not recover even after resting. Eye strain from digital devices or blue light. Blue light is a blue-colored light ray that comes from devices such as monitors, smartphones, and TVs. Unlike the long wavelengths of red, the shortest wavelengths appear in the area of household light, which causes spreading by colliding with fine particles in the air and scattering light. Blue light has the shortest wavelength in the visible light range. Therefore, it clashes with microparticles in the air and scatters light, resulting in a glare phenomenon. Human eyes are known to try to focus on the glare and thus the ciliary muscle continues to move in a tense state, which results in eye strain. Human test results. A study was conducted to test the impact of astaxanthin. The study includes 40 subjects, 20 to 60 years old, 30.0 plus or minus 6.0 years for the control group, 32.4 plus or minus 6.4 years for the study group. They are healthy adults complaining of eye fatigue, who routinely watch TV, play games, or use computers, operated VDT for more than 1 year and are engaged in digital media for more than 4 hours a day. Daily intake: astaxanthin 6 mg per day, once a day, taken after dinner. Duration of consumption: 4 weeks. The control, amplitude of accommodation, refers to the function of controlling the eye's focus, and the control was evaluated by measuring the near point distance and the far point distance. As a result of the measurements, it was judged that the level of control, rate of change, in the astaxanthin, Haematococcus extract, intake group significantly increased and that there was also improvement in eye fatigue. Third, zinc, needed for proper immune function, needed for proper cell division, daily intake, 2.55 to 12 mg. Fourth, vitamin A, required for eye health, needed for eyes to adjust to dark places, needed to form the mucous membrane of the skin and maintain its function, needed for epithelial cell growth and development, daily intake, 210 to 1000 micrograms of retinol, UG-Re. Vitamin A is found in the form of carotenoids in animal-based and green and yellow plant-based foods. Vitamin A is needed for the retina of the eye to convert light into a cranial nerve transmission signal or neurotransmitter signal. Vitamin A and opsins must be combined to form rhodopsin, which helps maintain visual activity. If vitamin A is insufficient, it becomes harder to see in dark places because rhodopsin cannot be formed in the rod cells. Vitamin A can be found in liver, carrots, sweet potatoes, sunflower, tomatoes, spinach, and parsley. It can also be found in seafood, yeast, pumpkins, apples, and chives, etc. Atomy Eye Health Luaxanthin contains 6 supplementary ingredients: sicklepod tea, goji berries, borage seed oil, orange tree, mixed berries, and hyaluronic acid. Sicklepod tea is a tea made from roasted, but not ground, seeds of senna, formerly cassia. It helps recover eye fatigue, protects vision, improve dry eye syndrome. Goji berry prevents aging of eyes, protects vision, contains antioxidants. Borage seed oil improves blood cholesterol and improves blood circulation. Sweet orange tree contains antioxidants, rich in beta-carotene, which is involved in the metabolism of optic cells. Berry mix contains antioxidants and protects vision. Hyaluronic acid improves dry eye syndrome and promotes anti-aging. Atomy Eye Health Luaxanthin uses plant-based capsules extracted from tapioca. The raw materials of the capsules is tapioca starch. Plant-based capsules strongly resistant to changes in external environment, such as temperature and humidity. The plant-based capsules has received some certificates, such as kosher certificate, halal certificate, certificate of origin, certificate of non-GMO, SGS, certificate of non-GMO compliance. Health information. First, eye strain. When you work by looking at computer monitors or smart devices for a long time, the shape adjustment function of your ciliary muscles are reduced due to strain. This function may not be restored even after rest. Second, eye strain or blue light from visual media. Blue light is a blue-colored light ray that comes from devices such as monitors, smartphones, and TVs. Unlike the long wavelengths of red, the shortest wavelengths appear in the area of household light, which causes spreading by colliding with fine particles in the air and scattering light. The human eye tries to focus and keep up with the phenomenon caused by the scattering of blue light, which is known to lead to eye strain as a result of the continuous movement of the ciliary muscle. Third, macular and macular degeneration. Macula is the colored areas in the form of eggs around the retina of the human eye and some animal eyes. Macula has an important role in vision, such as recognition of objects and color distinction, where light entering the cornea and lens of the eye is matched and the river of objects is matched. The cone cells involved in light, color, and shape detection are located at particularly high densities. The cause of macular degeneration: capillary failure caused by abnormal vascular production in the retina, factors such as smoking, high-fat, high-calorie eating habits, stress, obesity, high blood pressure, and family history affect. This is the location and structure of the macula. The older you get, the less macular pigment density you have. The following is the clinical trial result of astaxanthin consumption. The graphic shows functional raw material Haematococcus pluvialis human clinical trial results. The effects of astaxanthin on retinal capillary blood flow. Intake of 6 mg per day for 4 weeks. The clinical trial shows that there is significantly improved retinal capillary blood flow following astaxanthin ingestion. Causes deteriorating eye function. There are physical causes and environmental causes. The physical causes include deterioration of the ciliary body, which controls perspective, or aging of optic nerves or retina. The environmental causes include television, game consoles, computer usage, stress, nutritional status, poor eating habits, smoking, etc. Lifestyle tips for eye health. Adults 40 years or older should have regular eye examinations. Have consistent checkups if you have diabetes, high blood pressure, and dyslipidemia, hyperlipidemia. Consult a doctor when wearing contact lenses. Quit smoking. Wear a hat or sunglasses to block out UV rays during outdoor activities. Maintain proper room temperature and humidity. Use proper lighting indoors to avoid eye strain. Use appropriate protective gear during work and/or exercise. Maintain good posture. Take frequent breaks when reading, watching television, using computers, etc. Drink plenty of water. Consume foods good for eye health, for example egg yolk, fruits, and green, yellow vegetables. Reduce stress and avoid alcohol. Target consumers of Atomy Eye Health Luaxanthin. We recommend it for these people. Anyone with a dull eyes due to aging. Anyone who drives a lot at night. Anyone who enjoys watching TV. Young people and office workers who use computers for long periods of time. Anyone who gets frequent eye exposure to harmful ultraviolet rays. Anyone who feels like they need to resupply nutrition for their eye health. Precautions when taking. In the case of any special conditions or allergies, there may be excessive effects depending on the individual. Do not consume the silica gel packet in the container. Those who are infants, children, pregnant or breastfeeding should be cautious when taking. In case of overconsumption, your skin may turn yellow. This may hinder the absorption of beta-carotene. In case of any abnormal side effects, stop taking and consult with an expert. Do not consume if expired.